Kani kadega batesi TV, bat pidang pet yaki kubor baman kasni, balwan rasha pi da ka orange nisan, lom so po niya fabricate Shillong, ringkat bat ka BDW International School Nongmansong, Langkarding Shillong. Admissions open now. Watla ka jala Meghalaya, kadang light na utaw kanyang jingpang COVID-19, new coronavirus, yaw balajute pajba, kumbala pansay, do Menteri Sorkar, kani ka jala uba kami ikatnat ka kot kakya uba Alexander Hack hakatayo balala. Henry ka Sorkar, kamsyam la kensting satya, bat kalapan kaya lupa nakabanta kani. Haka jingkran bat kinong patay kubor, u Commissioner and Secretary jong ka Sorkar Meghalaya, uba kami ikatnat Health and Family Welfare, u Sempat Kumar IAS. Ulay to ba Sienjam bala Shim na ka Sorkar. Kumno ban pasok to ikipaj ba, halor ka ka ba kiday bande, bat ka ba kimday bande. Kamtam ban side ikikiti jongki, da kasaban bon siya na kasisngi, ban omtor jan palan, bat kibriyo ki badangwan na syabar jala, ni nabari bat kumta terter. Usampat Kumar ulay turu, ba kumbakalong menta ka Sorkar ka petngor ba, ye kibriyo ki bawan na bar jala, bat kamtam na syabari. Da kababu syua ye ki, katsaw sngi, haki observation ward. Bat ladadan ki basuba, yo ye kani kejingpang, la ban pat tespat, han Negrims Hospital, hamau ding-ding. Nalor kani ulay turu, baka Sorkar, nalor bakala pansangye syua shipor, ye ki yew hakapot, bat kari Bangladesh, ne ki bodarhan, laburu ye kakenhon jong ki doktor, hadaw ki bat dalu, ki badan ki kerdop, bayarong yami apadang kari India bat Bangladesh, lengba ka surok. Usampat Kumar ulay to bakatnat ka kot kakya, hadu menta kalaburu, hadu shispa artli, ki isolation bed, hakal leng kejela, ban nalor kane, la aji kairu, ye ki nong tray, jong katnat ka kot kakya. Ban itu iki dakishen lada suba ba uno ne kanu kabriyo kiyo iki ne jingpang kentop ru iki nong tray jong ka GVK EMRI kabapanya ye ka 108 emergency service hakaba kibriyo ki bas ngau shitam bas ngau ardatien kila ban phone how number 108 banya to ye jing ngau shitam jongki ban penpriang ye ka jing nang jing tep halor kumno banyada nagani ka jingpang corona ka Sorkar kalai tre langru berkirang basnong kinoi lam jong kiniam ba per ajihika yeki haba kidan ki jingle niam bahe.
Ever since actually this outbreak has been notified in China, the government of India has advised all the states to take steps, and in fact in Meghalaya we have started very early in the month of January. We have taken this particular thing very seriously, and we have actually, what we did was actually we have put up a system where especially the people who are coming from these affected countries have to be notified, and through our helpline 108, and over 70 people so far actually have notified, who have come from China and other places, affected places, and they have been kept under observation. And every day our health department surveillance team members they contact these people who have come from abroad, and then asking them like whether they have any symptoms and related to this particular disease, and they have in fact so far actually over 60 people have passed through that observation period and without any symptoms. So that's something, that's the first step, is because a lot of students were studying in China, they had returned back after this outbreak. So that's one thing that the state has done. And in addition to that, when actually this particular coronavirus also has been detected in India, then again especially some cases have been reported. So what we have said is that we have been asking the people who have been traveling from the affected places within India. Also, for example, a lot of students are coming from Maharashtra and other places. We are asking them also to notify the deputy commissioners through 108 helpline, and then they are also again observed. Basically, they'll be told do's and don'ts, especially they have to maintain that self-isolation for at least for 14-day period, so that and also practice this hand hygiene and respiratory etiquette. So this is a kind of a protocol that actually we have been put in place. So we have also been requesting all other people to cooperate, and also voluntarily, basically we are asking them to notify. The one important thing is that they have to notify, where from they are coming. Suppose if they are coming from an affected place, affected country, they need to notify and take all precautions, so that they will not be, because the issue with this particular thing is that there is a there is a dormant period, there is an incubation period. So people, if coming from the affected countries, if they are carrying this particular thing, they have to be put in a quarantine. Quarantine means basically they have to, at least for 14 days, they have to be self-isolated, so that in 14 days period it will come out whether actually they have any particular symptoms are there or not. So that care, in fact, we are laying a lot of emphasis on that one, especially people who are having a travel history. They have to get notified. They have to notify. Deputy commissioners, are monitoring this one in every district now. And there is a 108 helpline. In fact, we have trained all these 108 and doctors on this particular protocols, and they are guiding. In fact, they're also we also have issued instructions to the hotels, to inform if anybody with a travel history, who's coming from affected countries, they have to immediately notify through 108 to the district administration. So immediately district administration would go and do that screening and other things that is required. So that's one system that we kept. And the other thing is that Negrims has got the testing facility now. So basically, and we have also given training to all the doctors across the state how to actually basically test, take the samples and we put in a system how actually the samples have to be very carefully transported to Negrims for further testing, and where the Negrims actually has that facility to test here, and they can actually, if it is negative, they will confirm here itself. If it is a positive, they will send it to NIV Pune, National Institute of Virology Pune, where that will be confirmed. So that's the kind of a system that we have kept in place, and we also actually been focusing on training the paramedical staff and all the doctors of the state, and also engaging the district disaster management authorities, gearing them up for any eventuality, training them on actually how actually this entire management has to be done. So basically, though as I mentioned earlier that though we don't have any cases, but we are actually taking steps in such a way that if there is any eventuality, we are able to respond to the situation that demands. So that's the kind of a work, and all the deputy commissioners are actually taking a lot of steps. In fact, they are calling for meetings with the Rangbashnams, headmen, so that through them actually they are actually sensitizing the communities, especially on this, as I said, this important practices, distancing, and then the hand hygiene practices, respiratory etiquette. I think these are the focus areas that actually we are working on, and we are also asked the deputy commissioners to have a meeting with the religious leaders, to seek their cooperation to sensitize and to bring awareness among the public. Not one is that it's what is required here is not to be panic. Actually, what is required is information. What basically a lot of, because it's a new thing, many people do not have the information. So what the need of the hour is to really bring that awareness, and give that kind of an assurance that what is essentially these are the practices that we need to follow, and we need to be careful. So if you are careful in these steps, as I said, one is that you are not visiting the affected places. One, suppose if you are coming from an affected place, self quarantine yourself first, and if you have symptoms, go to the doctor, and there is a place, and then from there actually the testing and all will be done. So there is if you follow these systems, and second thing is that we follow continuously this hand hygiene practices, and what is required here is that you require a testing facility. So we are fortunate that we have a testing facility in the state, and so one is that suppose if there is any symptomatic cases, we can actually test them and actually put. Then the second thing, we require isolation places. So that also have been identified. So as I said, like we are also now trying to, though we have actually created, as I said, like 102 isolation places have been, beds have been identified. But we also actually now putting an effort to improve that one. Like basically surge, that's called surge capacity. If there is, as you said, like we should not actually expect that one. But we are preparing ourselves, getting additional stocks, getting additional beds, getting additional ventilators. This is the need of the hour. So basically it's a kind of a foresight, and we in fact a kind of a, you need to really prepare for that, if there is any eventuality. So we are actually making that one. So that's why we have asked today all the hospitals identify the additional isolation places, so where actually you can do it. For example, so some of the hospitals which are actually not being used, so we are identifying them, actually trying to make them as an isolation places. WHO has given a 4-stage kind of a thing. We are in the stage 1 only, no cases, but we are preparing ourselves, so that because we are all connected. So as I said, the spread, because there is a high transmission rate for this particular virus. So if you ask me, the reading is that yes, in fact, there is a concern. So that's where the government has taken very seriously this one. And as I said, we have been quietly working. From 24th January, we have been working very quietly. In the sense, we have got about 60 people have come up. They have been actually observed on a daily basis, and putting all those efforts. And the government of India actually on a daily basis, they are taking reviews, and providing a lot of guidance and protocols. So there is and we also very fortunate that way. Our state is fortunate because some other states have already experienced this particular issue. For example, Kerala, and we are seeing their protocols, how actually they handle that issues where they actually could not handle. So we can actually learn from those things, and we could able to take effective steps to handle this properly. So we are that way. We are in a good shape, and our chief secretary is reviewing it on a daily basis, and chief minister. So we are and our health minister. So that's that way we as I said, we have taken it seriously. And in fact, yesterday there was a discussion in the assembly, and all members have actually also have expressed concern, and there is a discussion, and a lot of a commitment all over from everyone is coming up.